again, welcome everyone. My name is Thomas Egdorf. I'm the Education Development Coordinator with Casey House. Here today in partnership with the OHTN, and with us is Diana Campbell and Tanya Oxholm. Very happy to be working with them again. And we're presenting the Gender Affirming Care Lunch and Learn series. This is a 4-part webinar series, one session each week for the next 4 weeks. Today, we're talking about the introduction to gender affirming care. Before we get into the actual session, I wanted to start us off well by reading our land acknowledgement. We gather today with profound respect and gratitude for the traditional caretakers of these lands, the Indigenous peoples. Long before it was called Canada, these lands were home to diverse First Nations, Métis, and Inuit communities. We recognize that the legacies of colonialization extend far beyond what we now call Canada. Around the world, Indigenous peoples continue to experience violence, displacement, and long-lasting effects of colonialism. These realities intersect with issues such as land occupation, the politics of borders, and systemic inequalities. From economic security to housing, gender identity, and access to healthcare, these global crises reflect the ongoing struggle for justice, dignity, and human rights. We recognize the suffering, displacement, and loss that such conflicts inflict on communities and commit to standing in solidarity with all those fighting for self-determination and peace. In the spirit of truth and reconciliation, we are called to confront the ongoing realities of colonialism. Our acknowledgement today is more than words. It is a call to action. We must actively work to dismantle colonial systems that continue to harm Indigenous peoples, both locally and globally. I just want to also acknowledge that today marks the beginning of Trans Awareness Week, which leads into Trans Day of Remembrance on November 20th. We want to honor the many achievements and collective strength of trans communities, remember the trans people who were lost during the AIDS epidemic, and celebrate the resilience and brilliance of trans people living with or affected by HIV today. And now I'll introduce our speakers. Today we have Michelle Hermans, who is a nurse practitioner with more than 15 years of experience supporting diverse client populations and is passionate about working with youth and young adults. Michelle is an advocate for marginalized populations, specifically for the trans and gender diverse community. As such, Michelle has received extensive training and provides gender affirming care to clients of all ages, supporting people with gender identity, hormone replacement therapy, referrals, and surgical assessments. Also joining us is Asya Gunduz, who is with the OHTN and is a community builder advocate with over 10 years of experience advancing gender justice, trans political advocacy, and health equality. Asya currently serves as lead trans and gender diverse people HIV prevention and health promotion at the Ontario HIV Treatment Network, where she is building a regional network of trans Ontarians working in healthcare. She also serves as board chair at Maggie's, SW Justice Organization, board secretary at CBRC, and co-founder of Lubin TO, a collective supporting queer and trans newcomers. She's also, if that's not enough already, she also was instrumental in helping to put this series together. And without further ado, I will turn it over to Michelle.
All right, welcome everyone. Thanks so much for joining today. It's so great to be here and to share some information about gender affirming care. We have about 20 minutes for me to share just the kind of a background of gender affirming care. I feel like I can talk about it all day, but we'll go through the next 20 minutes. My journey into gender affirming care began around 2019. I worked on a mobile clinic and I recognized a significant gap in accessible supports for people. And so thankfully, with the support of my organization, I was able to create and expand the first gender affirming healthcare clinic in York Region, and it continues to be successful and funded to this day. So it's been a really great journey and I've learned so much through it. So today I'm going to kind of talk about, really focusing on building comfort and confidence in offering gender affirming care, especially within sexual health and HIV prevention settings. So I'll start with just what gender affirming care is and why it's important, some best practices. I'll go into a little bit of clinical components around gender affirming care. So if there's something that I'm not covering, feel free to ask a question in the chat for sure. And then some key takeaways and resources at the end. So why gender affirming care matters? For me, I think for a lot of people and in research, it really is life-saving. A lot of the research shows that when trans and gender diverse people receive affirming care, their risk of suicide drops dramatically. They have a lot lower rates of depression and other mental health conditions as well. So our interactions truly do matter. And there even has been studies to show that affirming care improves HIV prevention and treatment adherence too. I think really when it comes down to is when clients feel respected and believed, they're more open about their experiences. And that obviously helps us provide better care. I don't see it as specialty care. And I know sometimes in the healthcare spaces, it can be seen that way. It really isn't. It's basic primary care. And gender affirming care itself, really helps by offering things like name and pronoun support, mental health care as well, medical options if people want, so people can feel comfortable and confident in their own bodies and identity. Gender affirming care, I find, does not stand alone. It has been built on very strong clinical, ethical, and human rights foundations too. So there is one standard called WPATH, which is the World Professional Association for Transgender Health. There's a standard guideline, and CPATH is the Canadian version of that. Both of these standards recognize gender affirming care as a human right. So, it talks about how care should be accessible and evidence-based and really guided by each person's own needs and not by gatekeeping. And particularly in Canada, gender identity and expression, they're actually protected under the Charter for Human Rights Act. So offering inclusive, affirming care is really our legal and ethical responsibility too. And I think sometimes it's helpful to look at it through an equity lens, especially if you are in the field of HIV and STBBI care. It's important to understand how gender diversity can intersect with things like racism and poverty, housing, stigma. I think it helps to address the systems that are actually making care harder to reach versus this idea of like fixing people. So I'll go over a few key terms. This may be familiar to you already, so this could be a bit of a review. But I think it's important we start with language because language is a form of care too. So sex assigned at birth is the label given when someone is born, so usually male, female, or intersex. But that label doesn't define who someone is. Gender identity is really a person's internal sense of who they are. And this may or may not align with what is assigned at birth. And then this can get confusing too, I think, gender identity, gender expression. That is really how people show their gender to the world. So it can be through clothing, hairstyle, voice, or even mannerisms. But I think it's important to just be mindful that expression doesn't always match identity, and that's okay. It's just, we should never assume someone's gender based on their appearance. Some other terms you may have heard or be familiar with too. Cisgender, that means somebody whose identity aligns with their sex assigned at birth. Transgender means that it doesn't. And another term too that you may commonly hear is non-binary. So these may be people who identify outside of or between male and female. And I mentioned intersex too as sex assigned at birth. So that refers to more of the natural variations in actual sex characteristics of the body. But I think in all of this, using correct terms being open to correction, it really does help to build safety and trust with people. And one of the simplest ways that we can show respect is by using someone's correct name and pronouns. And pronouns are words like she, he, they. There's other ones too that you may hear that we use instead of someone's name. And, it shows respect for their identity and how they want to be referred to. So for me, instead of, guessing, it's a simple ask, what pronouns do you use? That one question can tell somebody that you see them, that this is a safe space to be themselves. I also wanted to share some simple but really powerful ways to make care safer in the work that you're doing and just feel more affirming for people as well. So one of them is respecting privacy and confidentiality. And I feel like that is pretty common sense. But really, when someone chooses to share their name or pronouns or gender identity, it's important that we treat that information with care. It may be the first time that they're telling somebody that. So sometimes I'll even ask to, can I document this in your chart, or would you be okay with me sharing this with other providers? And just having that level of trust and transparency, it can help create a safe space. This one, unfortunately, I still see a lot, and it's really difficult, but just avoid unnecessary or invasive questions. So really, that means asking only what is medically relevant. So for example, if a question about anatomy or surgery is needed, explain why. Ask permission first and then have the conversation, but don't ask questions just out of curiosity. It's also important to take a trauma-informed approach. So many clients can carry experiences of stigma, of discrimination, of rejection. So sometimes it's helpful when you are kind of broaching sensitive topics. You can even say, and I use this a lot in my conversations too, that, some of these questions may be really personal. If you don't feel comfortable answering, that's totally okay. We'll move on to the next question as well. So they just don't feel the pressure that they have to disclose anything that is really uncomfortable. And I know I briefly mentioned this, but again, not assuming based on appearance or voice. So gender expression may not always match identity. And again, that's where those questions of what name and pronouns would you like me to use are really helpful. And we make mistakes. We're all not perfect. And if gender affirming care is something that you're starting to practice, and we can make mistakes. So it really is correcting it, apologizing, and kind of continuing to create that relationship with people. And there's even simple things, creating a visibly inclusive environment through inclusive signage or using affirming intake forms, ensuring staff are trained as well to use things like correct names and pronouns, and even being able to offer privacy during sensitive conversations too. I always think, I try to remind myself, clients sometimes may forget what you said, but they'll always remember how you made them feel. So these are some things I think that can be really helpful as you're kind of meeting people and building those relationships to create some safety and trust as well. The other thing I think about too is called clinical humility. And I don't know if you're familiar with that term, but it really means that we don't always have all the answers. So it's about being open to learning from the person who's in front of us. And with that, we listen, we ask respectful questions, and we're partners in care rather than acting as the expert, because unfortunately, that's also something that happens. And so having that partnerships makes a lot of difference. But I find that humility kind of helps us move past the fear of saying the wrong thing and really focuses on connection instead. So simple questions like, what feels most comfortable for you? That can help build trust and safety. And part of this too, you may be familiar with the term intersectionality. That that term there reminds us that trans and gender diverse people, they have diverse experiences, and sometimes these experiences are shaped by things like race and class, sexuality, culture, health. But it's important to know that these barriers, they overlap and they actually intensify each other. They don't just exist in isolation. So when we're mindful of this, together with humility and intersectionality, it helps us to stay open and accountable and more compassionate in the care that we're providing. So we'll get into a little bit of the clinical side of things. For many, many years, access to gender affirming hormones or surgery, it often requires psychiatric assessments, diagnoses, specialist referrals, and unfortunately, it still does happen today. But it's starting to change. But sometimes I still hear about these things. This really is known as the gatekeeping model. So it places the provider in a role of determining whether a person is trans enough to receive care, but it really delays access. It increases distress. It assumes that trans people need to prove themselves in order to access basic medical treatment. The informed consent model is really now the standard that's recommended by WPATH and supported by many organizations, including ones like Rainbow Health Ontario. But in this model, the provider will give clear information on the risks, the benefits, the effects of treatment, and then it's the client who decides whether to proceed. A diagnosis of gender dysphoria, so that's when somebody essentially has distress related to their body, it's not required. And mental health support is available, but it's not mandatory. So now the emphasis becomes on things like autonomy and agency and capacity and access. And really, this is ethically aligned with the way we deliver most medical care in primary practice. So it should also be, relevant in gender affirming care too. I'm going to briefly skim over the types of hormones that are used in gender affirming care. And this is just kind of a high level overview. So again, if you have any specific questions, feel free to add it in the chat too. This slide here talks about feminizing hormone therapy. So that typically involves estrogen, and sometimes we combine this with what's called an anti-androgen. So the ones that are most commonly used in Ontario are spironolactone and cyproterone, and they work to help reduce testosterone levels in the body. But the goal is to promote various changes, such as breast development, fat redistribution, softer skin, and sometimes even reduced body and facial hair a bit. These medications are, safe and evidence-based. We have these hormones in our bodies already. We're just adjusting the levels of it. In terms of the different types, there's oral estrogen. So it's a tablet that people will take once a day. There is transdermal estrogen, which is administered through a patch or gel. I wouldn't say that's as commonly used, but it is available. And then there's also injectable estrogen. So some people will take that once a week or once every 5 days. The dosing, there is a standard dosing, and I have it on the slide here, but there's not really a one-size-fits-all approach necessarily. And so it's really, working with those clients and supporting them around their goals, and sometimes in determining what that looks like for dosing. For clients who are taking spironolactone, that is a medication that works as a diuretic, and for heart failure, blood pressure, it's used for various things, but we know that it also helps to reduce testosterone. But because of that, it's important to remember that this medication can increase things like potassium levels, which can affect kidney function. So we do blood work before people start hormones, and then usually about 3 or 4 months after they start, and from there kind of once a year. But we'll monitor things like potassium and creatinine periodically just to make sure those levels stay safe. Estrogen as well may influence liver function as well as cholesterol or lipid profiles. So those are also checked as part of ongoing care too. And there are actually people who just take estrogen without anti-androgens too. Like I said, there's not a one-size-fits-all approach. So that happens as well. On the other side of things is masculinizing hormone therapy. So that uses testosterone. And this can be delivered as an injection, which I would say is the most common formulation that is used, as a gel as well, that's once a day, or a patch too, but we don't really often see that too much in Ontario with the patch. The goal is to increase muscle mass. It deepens the voice. It stimulates facial and body hair growth, and it redistributes body fat as well. Some of these changes, including ones with feminizing hormones, are reversible, and some of them are permanent as well. So it's important to have conversations with your clients around that, just so they're aware as part of informed consent. But during testosterone therapy, providers will monitor things like hemoglobin and hematocrit, because testosterone can raise red blood cell counts as well. And then we'll also check things like liver enzymes and testosterone levels to make sure that the dose remains in a safe and effective range. I think the key message really is that you don't necessarily have to prescribe hormones to understand them. And it's really good to have a basic knowledge of what your clients might be taking, what to look out for. It can help you kind of coordinate care better and even recognize possible side effects. Hormone therapy is certainly not experimental. It has been around for such a long time. It's grounded in decades of clinical evidence. And it really, really shows in all of the research that many people will have significant improvements in mental health, in their well-being, in their quality of life. It really is about aligning their physical body with their gender identity and helping them to live just more comfortably and authentically and confidently in the world. I did include a really brief part about youth considerations as well. So generally, I would say youth under the age of 15 may access gender affirming care for what's called puberty blockers. Lupron is a brand name. It's a gonadotropin releasing hormone analog. It's an injection that's given every 3 months. Youth can take puberty blockers when they've reached what's called Tanner stage 2 in their development. So that generally is like breast bud development or enlargement in testicles and scrotum. And we can consider puberty blockers at that time. But this medication just pauses puberty essentially. So it prevents those unwanted physical changes, and it gives young people more time to explore their gender identity safely. These effects are reversible, so when they're stopped, puberty resumes. And I think for many people, this is a critical time-sensitive step, that really helps to reduce distress and supports their mental health during early adolescence. And then I also just briefly included some information for people who identify as non-binary or gender diverse. Sometimes they also seek gender affirming healthcare for various reasons too, and may want to also use hormones. And so there is options to use low dose hormone. We say it microdosing. Sometimes you might hear that term. And that's being used to achieve more subtle and sometimes specific changes as well. But again, there's really not a one size fits all approach. And also gender and goals can change. And so it's good to revisit care plans regularly and stay flexible and really affirm evolving identities. I think of myself as a teenager and how different I am now. And so understandably, people's gender identity, gender expression, all of that may fluctuate too. And it's just important to support them through that and normalize that part of it. And then I'll briefly kind of go over some of these surgeries that are available through Gender Affirming Care too in Ontario. So there's masculinizing surgeries. We say top surgery. The medical term is mastectomy. A hysterectomy, oophorectomy is when a uterus and or ovaries are removed. Metoidioplasty is essentially when the ligament around the clitoris area is cut, and so it creates what's called a micropenis. Phalloplasty is when they actually create a penis out of existing tissue. That specific surgery is not offered very many places. So one of them is GRS Montreal that you can do within Canada. And then there's feminizing surgery. So breast augmentation, orchiectomy is where they remove the testicles, and vaginoplasty is where they use existing tissue to make a vagina with or without a vaginal canal too. These surgeries can be covered under OHIP. So there is an application that can be filled out by a healthcare provider, by a social worker with a master's degree, as well as a psychiatrist. And it can be submitted to the Ministry of Health to get funding for these surgeries. There is some specific criteria. Sometimes that's involved with it as well. Rainbow Health Ontario has fantastic training around resources and surgeries and even things like post-op care to be aware of as well. So I highly recommend you checking that out, and I have that as a resource as well. And I think, a lot of us work within the community. So for me, primary care is a big part of what I do. And I feel like it starts long before, you're seeing somebody in your office. It begins with how we collect information, like I said, so inclusive intake forms, using chosen name and pronouns. But forms should also separate gender identity from anatomy, so that screening is based on organs present and not gender markers. So I practice from an organ-based screening approach. So essentially anyone with a cervix needs cervical screening, and anyone with a prostate may need prostate screening. And breast and chest screening depends on tissue and hormone exposure. But I find when that screening matches anatomy, we avoid any misdiagnoses and unnecessary distress. And preventative care matters so much too. And I think that's often missed as well. But it's a really important thing to have those conversations and to open up the door to those conversations, offer HPV, hepatitis, flu, COVID-19 vaccines, all of that part of routine care. And with an affirming approach, it really shifts us from this gendered model to a human model of care, which is evidence-based and compassionate. I'll briefly just cover these barriers, and you may already be familiar with them, but there is some barriers to accessing gender affirming care. I wasn't taught gender affirming care when I was in school. It's starting to get better, but there is definitely a lack of training, which makes people uncomfortable in providing this care. So it's important to access that training. Certainly geography, and access to clinics is difficult. Experiences within the healthcare system, like misgendering or discrimination, can impair trust, and people may avoid the healthcare system as a result. If people aren't having, support from caregivers or family or friends, that makes it difficult to access sometimes. There still is very long wait times for access to things like hormones and surgeries as well. And of course, people waiting years sometimes for these things, it's just distressing, and it can really impact their mental health. And even legal implications, ID changes, they cost a lot of money. The paperwork is complex. So maybe people who, are kind of living in poverty, it makes it really difficult for them to access this as well. So what you can do now, I think we know, that a lot of trans and gender diverse clients have faced discrimination in healthcare. So trauma-informed care really starts with things like transparency and empathy, and small gestures that build trust. So what can we do right now to make our practices more affirming? And you may have already done all or some of these, but update your forms. Take a quick look at your intake forms. Do they include space for chosen name and pronouns? Do they ask about gender identity? These small changes just send a big message that you're seen and respected here. It's important to model inclusivity too. So add your pronouns to your email signature, to your name badge, to your Zoom name. It's a really simple way to just show that you're affirming, and it takes the pressure, off of clients to have to explain theirs first sometimes. Build your network. This is a hard thing even for providers too, but just knowing who's out there, starting a referral list of affirming providers, people will treat your clients with respect. Rainbow Health, again, has a directory that's fantastic. You can contact them directly, and they can share specific providers as well. And please keep learning. Gender affirming care evolves. Trainings from Rainbow Health Ontario and WPATH too. They're great ways to stay up to date and confident in your practice. And advocate where you can, like beyond the clinic. Think system-wide. Gender neutral washrooms, inclusive policies, ongoing staff education. I think each of us can use our voice to really help make healthcare safer for everyone. I'm going to throw these resources. I have the links here. So I'll put those in the chat after, but these are some great websites to check out as well. And like I said, I feel like affirming care isn't just specialty care. It's just good healthcare. These practices, through research, through evidence, through anecdotally, hearing from people, they reduce harm. They really do improve outcomes, and they help to build stronger relationships with our clients. Continued learning is certainly a big part of it, and staying accountable and effective too, but it does go a long way. These are my references, and thank you. Thank you so much for taking the time to hear all of this and be here. Asya, you're up. Let me stop sharing.
Thank you so much, Rochelle. This was very educative and very insightful. Thank you for your work. Hi, everyone. My name is Asya. Right. I hope everyone can see. Hi. I'll start thanking all my teams first at the Ontario HIV Treatment Network. Tanya, Diana, thank you so much for making this happen. And also Thomas Egdorf from Casey House. I also would like to thank Michelle and all the other practitioners that you're gonna see in this lunch and learn series. I'm really thankful and grateful for them to be here and to be supporting trans health with dedication. Today, I'll be talking about social and legal transition needs and barriers as well in Ontario. And also, most importantly, as most of you maybe are from an ASO or CHC community health organization or healthcare provider, what you can do to support people like me, people in real and everyday ways. And my goal is to keep this very practical and grounded in what's already happening across the province. And you will leave with examples, steps you can take immediately, and resources your teams can share with community members. And these are some of the topics that we're going to cover. I'm going to start with definitions. We're going to dive into needs and barriers, and we're going to talk about some of the suggestions for specifically ASOs, AIDS service organizations, and community health clinics. So before anything else, I'd like to make sure we're speaking the same terms and definitions. When we talk about social and legal transition, it is very connected and integrated sometimes to medical care. And it is as major part as, medical transition. It is even most of the time, first steps of the transitioning in your gender transition journey. Social transition refers to all the everyday non-medical ways that people live as their gender. And this can include using a chosen name, pronouns, clothing, grooming, voice, and communication choices, bathrooms and change rooms, social and workplace accommodations, safety planning, and building supportive environments around trans people. So when we talk about, for example, a safety plan for trans people as your clients, including creating safe environments for their mental and physical safety, so that would also include your efforts into supporting the social transition of trans and gender diverse people, because it would also contribute to the needs of and to the kind of infrastructure needs of the social transition. When we talk
Asya,
about,
can I interrupt for 1 second? Your slides aren't advancing.
Oh, they aren't advancing? Okay,
No.
let me check. Sorry.
We just see the title page. Perfect. Now they're going. Thank you so much.
Now they're going? Okay.
Yes, thank you.
Okay, great. Okay. Thank you for that. Yes. So, and it's important to recognize the legal transition as well. This includes changing all the markers, sex markers in your birth certificate, Ontario IDs, the driver's license, and this also includes changing your name. And for changing name, for example, there is a provincial procedures, and there's also federal procedures that you need to do step by step. As you know, they cannot make a system that is easier for us. So you need to take hundreds of steps to do some of these changes. And it's important to recognize the diversity of transition needs as well. As, for example, Michelle also mentioned, it is very person-centered as well, right? What you need as from hormones and from what you need as, from surgeries, if you want surgeries or not, etc. So for trans feminine people, needs may include voice and communication training, tucking safety, hair removal resources, makeup, and navigating name and marker changes. And for trans-mask people, this may include safe binding practices, packing, hair and styling choices, sports participation policies, and navigating updates on IDs and school and work systems. And for non-binary people as well, all of these can, apply, and also including, flexible pronoun use, access to X markers in governmental and ASO forms and navigation and intake forms is important. So all across groups, there are intersection realities: age and parental control for youth, immigration and documentation status, housing insecurity, disability. So many of these layers shape whether people can even start a social or legal transition. So that's why for some of the trans people, you will observe they start the medical transition first, because it kind of comes not over a day, right? So it comes in slow process. In like 3 months, in 6 months, you see the difference, right? So the phases of transitions can also depend on the person and how they want to transition, or if they are safe enough for social and legal transition. Okay. So we're talking about social and legal transition, but why does it matter? And then and I would like to show you some evidence-based informations as well, some health interventions too. So chosen name use is directly linked to improved mental health. For example, most of the studies found that using a chosen name across multiple settings sharply reduces isolation, suicidality, and also the attempts in trans youth. And also gender congruent ID lowers psychological distress among adults. And studies show that adults with all IDs updated had significantly lower distress and suicidality compared to those with mismatched documents. And finally, international standards of care, World Practitioners Association of Transgender Health, explicitly frame social and legal affirmation as integral components of holistic gender affirming care. All right. Ontario has a patchwork system of support for this, and it doesn't really support you economically either. And if you ask me, the only thing that they support is the surgeries and the spot of surgery and some of the top surgeries for transmask. And if you're under ODB, they cover some of the drugs, but Ontario drug methods. But for the social and legal transition, there are no state level funding for coverage. Service Ontario and Office Registrar General handle the legal name changes and birth registration sex designation changes. And there are also community legal clinics and ID clinics. There are community health centers that you can get help with. Some of them offer ID clinics. And there are queer organizations, plus LGBTQ+ organizations offer peer navigation around this. And some of them actually also, for example, host clothes drive and clothes exchange events. Some of them offer some of the microphones for the trans communities. So to spot those organizations is also important. And I've been doing an environmental scan as part of the OHGN, and hopefully this slide will change. No, not this one. Yes. And you can see some of the examples where you can find information and support in Ontario for Ontario ASOs and the community health centers. And my scan also covers many others like Max Ottawa that I couldn't put here. Kuchiching FHD has some social and legal support systems. Norwest in the north, Thunder Bay community health centers have some support systems, and HARP as well in Saint-Saul-Marie has these support groups and systems. So these help trans people not only in accessing, for example, a doctor, but also these are sometimes some of the first places that trans people go to an organization and see another trans people and see another person that resembles them and then asks them questions. And then that community ear-to-ear conversation taught me a lot of things, for example, in my own transition as well. And of course, there are many barriers to the social transition, such as cost and admin burdens. There's the cost for name change is $130, and then birth certificates, sex designation change is $35. And you can get supports from some of these organizations. And there are, for example, HQ's legal clinic in Toronto, and there are some legal clinics outside Toronto as well that trans people can have access. Because if you want to post your name change, you have to kind of find a notary. So for that notary, you also need to pay. So if you don't want to do that, so they at least cover the commissioner fee. And so that can be a cost-effective option for some trans people. All right. All right. So what are some of the practical suggestions that I can offer based on my, knowledge and experience? It's always important to look at what your organization can do, right? There's no kind of one simple prescription for every organization, but you can at least, change the names and gender parts in your intake forms as a start. Like adding their chosen name, kind of informing your staff about it. It's kind of simplest things to do. And if you have some funding as well, you can create your grant raising strategy in the organization and in governance to reflect the trans people's needs around social and legal needs. So you have integrated the gender affirming care not only from a medical aspect, but also social aspect. And you can create some of the events, pertaining to gender diverse clients, such as, you can, it's like some of them are really simple. For example, you can establish makeup event, right? Or you can do a clothes exchange. You can do, for example, how to wear a binder for trans mass folks, right? Or how to wear, or how to find the cheapest, tucking gaffs for trans femme folks. So all of those like navigation kind of tips and resources and education, I think are possible for our organizations to, and which they're already doing. But those are some of the like best examples of how to support with the social and legal transition. And there's also a navigation burden and confusion among trans people, because there are a lot of, misinformation. There's a lot of information sometimes to, go through. So maybe referral bundle packages would be nice to deliver, and to also have a specific, resource making program in your organizations to prepare those resources. And I would love to, support anyone who would want to reach out about that. Skills groups, programs. You can also find ways if you are, for example, if you have prep programming, as we're seeing more and more in ASOs and CHCs, you can always integrate those prep programming and ART programming to with your gender affirming care programming, which will include the social and legal aspects. And these are some resources that I'm sure Tanya can share later that you can find. This one is pretty great, Transhealth Ottawa. It's almost like, it's not only about Ottawa, it's an amazing library that you can go around, like find some family resources too, or if your child is trans, that you can find some resources. And these are some of the kind of justice trans. If you're, let's say, trans sex worker who is looking, information about your legal rights, then you can go ahead and check there. As I said, there are ID clinics in Ontario that you can check, and HQ is one of them. And HQ has one of them. And there's also a very comprehensive resource from the BC Health Authority. It's not Ontario resource, but it gives a great knowledge on binding, packing, tucking, padding. And if you want any family resources or any resource around fertility for trans people, there's a new resource from RHO, Rainbow Health Ontario, about that. What are our options as trans people if we're considering, fertility, or considering, preserving our genital assets, or if you want to have a child. Okay. And lastly, thank you. Thank you so much. I would like to thank you all for listening, and thank you again for all my teams. I also would like to emphasize the Trans Awareness Week starts today and ending on November 20, Trans Day of Remembrance. And there are events across Ontario that you can find. Some of them are under the ASOs and community health centers. So you can attend one and, have the opportunity to meet community members and support us. Yeah, and I'm handing it over to Thomas.
Great. Thank you both, Michelle and Asya, for your wonderful presentations. It's always a good reminder and to learn new things. And thank you as well for quickly answering the questions in the Q&A. I think they're all answered now, so that's wonderful. We do have a few minutes. If anyone has questions, please type them in the Q&A and we'll do our best to answer them. And just a reminder that next week we and I've lost where I put, oh, there it is, sorry. Next week, November 20th, is Gender Affirming Care and HIV treatment. Hope you'll all be able to attend that. And I see there is one more question. I don't know if Michelle or Asya, if you want to answer that live. Oh, I see.
For me, no problem. Yeah, I can share.
Okay. And I see that, oh, that one's been answered already. So again, thank you everyone for taking time out of your day. There's a survey that we ask you to quickly fill out, and the link for that is in the chat. It helps us as we develop future sessions. It helps to inform that planning. And if there's nothing else from our two presenters.
There's another question there, Thomas.
Oh, there's some more questions. Okay. Oh, bunch of questions now. Oh, are we? Yes. So we will send out the presentations. That was one of the questions as well. And let's see. Can you elaborate on the clinical humility and gender affirming care when it comes to working with two-spirited people?
Do you want to go, Michelle, or do you want me to?
Yeah, or maybe we can tag team it too if there's anything you want to add. I mean, I think it applies, right? Again, it's this idea of we don't know everything. And so we can create spaces where we can really listen and validate people's experiences and really work in partnerships. Because I think it's hard in healthcare settings where we get caught up on being so medicalized in things, right? And that's not always meaningful or applicable to people. So when you can take space to really listen and understand a person, validate their experiences, and work in partnership to really support them in the way that they meaningfully need to be supported, I think that we can do that, you know, through clinical humility as well. I don't know, Asya, if you have anything else to add.
Yeah, I agree. And I also recognize that I don't have much experience. However, I think one of the things that even doing my outreach to in terms of resource making and making connections, I think starting with honesty of where you're at in terms of if you are a settler, whether you are a newcomer or not, and then starting from there and acknowledging the lack of knowledge and then acknowledging the progress also that you're taking towards learning more about Two-Spirit, learning more about Indigenous folks. So I think those are some of the things that I think I am contextualizing my communications around this, either with someone from a network or someone from the community. Yeah, thank you for the question.
And I'll just mention there was a question a little bit earlier on about what if you have a patient that doesn't have an OHIP card? And thank you, Michelle, for answering that. I also just wanted to put a little shout out to the Blue Door Clinic that's housed currently at Casey House, and they work with people that don't have status in Canada, so including not having an OHIP card. You might want to reach out to them. I don't know if they can help with getting medications. They do help with HIV medications, so they might be able to, if not help directly, they may have a resource or a contact somewhere else that can support them. So you can Google Blue Door Clinic Toronto, and their phone number will come up.
Thank you so much. I think that's an amazing addition. And also there's a newcomer clinic under Women's College Hospital as well. If newcomers health is something that your clients are specific to. And for the Ontario system, it is really confusing in terms of, for example, I remember that one of my community members, a trans woman living with HIV, who wanted to reach out to ART because her meds were stolen in the border in Mexico, in the jail. So she couldn't reach out to meds like for 4 months. So then, finally we found support, but then, and there's also a kind of a wait time till then, till the IFHP, the Interim Federal Health Program, the refugee insurance comes along. So Blue Door Clinic really helped out to sort things out. They are working for the uninsured. And if you are, for example, out of IFHP, because if you're a conventional refugee and then you're accepted to Canada, and then after 3 months, IFHP ends. So you're going back to the basic OHIP if you're not under 24. So in that case, sometimes you are covered by the Ontario Works. So if you're under the Ontario Works, sometimes it's kind of a forgotten piece from providers, and then people sometimes pay to pharmacies, although, Ontario Works case, their case is open in Ontario Works, and it is also under the Ontario Direct Benefits. So those are some of the things that, especially for newcomers, that you can consider when prescribing PrEP, for example. So I know it's sometimes complicated. The insurance system is very complicated, but there are ways to navigate that.
Great, thank you. And that's all the questions we have and all the time we have. I hope you all have a very enjoyable rest of your Thursday.